If you develop a flat foot deformity after the age of 40 years, the most common cause for that is the tibialis posterior tendon dysfunction. That means that if your foot was normal in your youth and slowly and steadily you have developed a flat foot, then this is most likely to be because of posterior tibialis tendon problems or dysfunction. Now this dysfunction can range from tendinitis to partial tears to complete tears. Now in this video we will be talking about tibialis posterior tendon dysfunction. Now this is a very common ailment which usually occurs after the age of 40 years, more commonly in 50 to 60 years of age. It is more common in females as compared to males in the ratio of about 3:1. This problem is more common in those patients who are obese, who are hypertensive, those patients who are typically like having rheumatoid arthritis, any other form of arthritis, ankylosing spondylitis, seronegative arthropathy, those patients who are on steroid therapy, those patients who have got varus knees. So these all patients are at a high risk of developing this tibialis posterior dysfunction leading to an acquired flat foot. Now this disorder is usually a progressive disorder. The foot starts from a normal foot to a flat foot, the pes planus, then your heel goes into valgus and then your foot goes into abduction. So normally what happens, your foot is like this normally, but in this problem your foot collapses and becomes like this, and then hence you have not only pain but also discomfort in walking, discomfort in wearing shoes, and usually this problem is painful. This problem is characterized by pain which is on the medial side of the foot, and this is worsened with walking. And in late stages you may have lateral sided pain also because of lateral fibular impingement. Now there are several stages of this problem. Now this problem starts because of the tibialis posterior tendon dysfunction. That is, the tendon becomes weakened in the avascular zone. So tibialis posterior tendon has a avascular zone about 2 to 6 centimeter proximal to the navicular bone between the navicular and the medial malleolus, and this is the area where there are maximum tendon tears in the tibialis posterior tendon which are seen. Now this area is basically has poor blood supply, and hence the problems are more in this area. Now this tendon usually makes 3 strips, anterior, middle and posterior strips, and it supplies all the tarsal bones, and it serves as an arch, it serves as a support to the arch, and when this tendon is weakened, your arch collapses. So let's come to the staging part. Stage 1 is a stage of swelling and inflammation in the tendon which is called as tenosynovitis. This is basically a phase of swelling and inflammation in the tendon, but the tendon integrity is maintained and the patient is able to do raises, heel raises. This phase can be managed with our orthotic treatment, pain medications, rest. Very occasionally you can do arthroscopic management or debridement of the tendon. Now stage 2 is the most important stage, and this is the stage of a flexible flat foot. The patient do develop a flat foot, but it is correctable. Now this can be subdivided into type 2A, B and C. Type 2B you develop forefoot abduction as well, and type 2C you develop rotational deformity of the foot as well. But everything, there is no arthritis in stage 2, and this is the stage where you can do some surgery to correct the deformity to prevent the arthritis. Hence this disease should be approached at the right time. If you can address this disease up to the stage 2, you can prevent the progression of arthritis into stage 3 and stage 4. Now what can we do? You can do a corrective surgery. which includes FDL transfer. You remove or you just resect a part of tibialis posterior, and instead of tibialis posterior you support the flexor digitorum longus onto the same place. You reconstruct or repair the spring ligament. You do a calcaneum displacement osteotomy, that is medial displacement osteotomy of the calcaneum. You can do either a lateral column lengthening or medial shortening procedure, and this is usually done in type 2B and type 2C. And usually these surgeries, these reconstructive surgeries have got good results in form of prevention of further arthritis and recreation of the arch. But in some unfortunate patients, they approach to us late in stage 3 where the arthritis has already set in. So in those patients we need to do a limited tarsal arthrodesis, either a subtalar arthrodesis plus minus talonavicular arthrodesis, and in severe stages we might have to do a triple arthrodesis. You have to fuse all the bones of the tarsal. Now stage 4 is the worst of all stage, in which not only the foot but the ankle joint is also involved, and these patients need to be addressed with a pantalar sort of arthrodesis, in which we not only fuse the foot joints but also fuse the ankle joint. Friends, the whole emphasis of this video is to emphasize about the prevalence and the common nature of this disease, and if this disease is approached and identified at the right time, we can actually prevent the progression of this disease and we can prevent the arthritis from occurring. So if you can address this disease at the right time, you can prevent the further damage to your foot and ankle. Friends, if you have any more questions, you can write us on the comment box. Please do subscribe our channel, Advanced Hospitals. Thank you.